Hello everybody, in this video we will return to two dialogues you have seen in the intro to the part 2 of, of the course of Bach flower therapy. And now we will add comments, so you will see the techniques in action and also roadblocks in action. If you like to see again the videos about the techniques used in this video, so click on the link below. So this is a story of Vanessa, 30 years old woman. She has two children, lives with her third husband, and there is a suspicion of home violence. And we will demonstrate two dialogues. And the dialogue A is how not to do it, because the therapist uses so-called roadblocks, blocks in the communication. So we start with the open question. How are you? And you can see a forced smile in her, and she answers, I'm fine. However, you feel there is something wrong, that there is some discrepancy, incongruity. And it would sound like agrimony. It's quite possible that she needs agrimony. And the therapist reacts, no, I can see you are not fine. Something is wrong. So this is a roadblock called arguing with the patient. No, everything is okay. And some discord is starting. Oh no, this bruise on your arm, your husband has beaten you again. The therapist forcefully reveals the patient's secret, and she invades her private area. It was an accident. He did not want to hurt me. No, it wasn't an accident. It's over and over. I tell you, you must leave him, or otherwise he will injure you badly. So the therapist gives unsolicited advices, orders, threatens, all the roadblocks. He's a good man only when he has a lot of work he needs to let the tension go. He drinks alcohol and sometimes he hits me, but he has promised me that he will not drink anymore. In my experience, such men will never change, and they certainly won't change because of you. Again, giving information without permission, explaining. Believe me, I know him. He feels always very guilty next day and apologizes many times. So she defends her husband. She is on his side. It is a typical story of abused women. The husband beats them, then he promises he will be good, and then he beats them again, and this beating will be still worse. By the way, what about the children? They aren't his, are they? Does he beat them too? Roadblock interpretation uses closed question. Oh no, he is nice to them. Only once, when my son was a little bit noisy and my husband had a headache, he slapped him, but normally he does not beat them. So she continues to defend her husband. So he has already beaten your son. If you are a responsible mother, loving your children, you will leave him. Otherwise, there is a risk that he can hurt them. So it's emotional extorting, evoking reproaches. So again, roadblocks. One roadblock after another. And now dialogue B. That probably will be much more successful. So open question, how are you? Again, forced smile, I am fine. There is an incongruity between words and mimic, probably agreement. Everything is absolutely okay. It's amplified reflection. Yes, most things are okay. So she admits that there is some problem. There are things that are okay and things that aren't. It's double-sided reflection. And after a while of hesitation, she reveals her secret. Yes, today I had a quarrel with my husband. You do not like conflicts. A reflection that explores underlying emotion, especially agreement doesn't like conflicts. No, I do not like quarrels, and they are more and more frequent. She confirms agreement theme. It's already too much for you. Again exploring underlying emotions. He is a good man, but sometimes he gets angry. Uh, he he's a good man and he sometimes beats you. It's double-sided reflection again. That reflects her inner dilemma. I sometimes even hesitate whether to leave him or not. So she already considers a change. Your feelings fluctuate. Sometimes you feel attracted to him, sometimes you have a fear of him. Again, double-sided reflection. Not fear, maybe yes, a little bit. You know, the children are only mine. They have another dad, and he sometimes gets angry at them. He has even once slapped my son. Little George did not understand why and began to cry. She accepts that there is a problem, there is maybe even some danger for the children. You are a good mother and cannot look at your children crying. It is an affirmation. She is a good mother. If he beat only me, it would be okay. I sometimes provoke him, but when he beats children, I feel terribly. It seems that these children can be a motivation for a change. You are really worried that he can hurt them. It's a guiding reflection, just suggesting this really worried theme. I would already leave him, but you know he is my third husband. Previous husbands were violent too, and I'm afraid that the next man I will find will be the same. So here you can see that the patient is already quite ready to make progress. He considers something. So there are some themes you can work on, and this preparation phase has been quite successful. On the other hand, in the first dialogue, in dialogue A chance that the therapy can be successful is very, very low. So thank you very much for watching this video. I hope you have enjoyed it. And in the next video, you will be able to verify your communication skills in a simple test.